Hey, everybody. Here's my interview with New York City published peer-reviewed gut specialist, Dr. Christine Bishara. You're going to find out about all those critters in our gut and why they can save your life. Hey, everybody. Welcome to this episode of Next Level Healing. I'm your host, Dr. Tara Perry. My guest today is Dr. Christine Bishara. She is a New York City-based integrative medical doctor who helps her patients heal through optimization of gut health. Her expertise lies in diagnosing medical conditions by assessing the health of the gut and the gut-brain axis while addressing and correcting nutritional deficiencies and allowing her patients to heal from within. Dr. Bishara is the best-selling author of The Gut Revolution, a book that explores how gut health impacts every aspect of health, including mental health, immune health, and weight management. She is a gut health pioneer, having published the first scientific peer-reviewed study linking COVID severity to gut health. Welcome, Dr. Christine.
Thank you so much for having me. I'm really looking forward to our talk.
Me too. So, your origin story is really interesting. You were rather overweight and had eczema. You were being bullied in school. Walk us back to that time and how that inspired you. And I love the story when you're a sophomore in high school and you're one of these people that when you're told you can't do something well, you're just going to up the bar and say, watch me.
Yeah, so I like renegades, and I think you're probably a renegade too. And I think we need more of us in the world. But yeah, so I was obese as a child and a teenager, and that's never fun. And I was bullied tremendously in school. And then one day I went to my pediatrician to have my annual weigh and, wellness exam. And she weighed me and she said to me, "You are 40 pounds above the upper limit of normal for your height and age." And she said, "You're considered obese." And then she said, "You're never going to lose the weight." And I was just shocked that she said that to me. And so it was a good wake up call, though, because I went home. It was the summer of my sophomore year. I was 15 years old. And I went home and I said, "No, I'm going to prove her wrong." And so I started dieting back in the 80s. Like, people didn't really know. You kind of just counted calories, right? And so I started counting calories, and that worked for a little bit, but then I started getting really hungry. And so then I said, you know what, let me try something else. So I started eating a little bit more, but healthier food. And then I started what we now know is intermittent fasting. But at the time, people were just like, "What, are you crazy? Like, you need to eat 3 square meals a day and all day long, and your body needs that." And I was like, I'm eating more and I'm eating healthier and I'm losing more weight. So I was restricting my eating time to about 14 hours, like 16 hours of fasting and 8 hours of eating. And that summer I lost 30 pounds. And then I just continued to lose it over time. And it's interesting because I really didn't know how it worked until I started medical school. And biochemistry is the subject that either like makes you or breaks you in medical school. And for me, I found it really interesting because I started reading about these pathways, these glucose metabolism pathways, and how your body is so smart. And when it doesn't get food, it kind of starts to burn internal sources like glycogen in the liver and fat. And, now we know like the burning of fat is ketosis, and a lot of people are doing ketogenic diets, but your body actually has pathways that start burning fat at certain times of the day. And this is where restricted eating actually benefits us.
Well, that was really smart of you to pick that up, because a lot of doctors go through medical school and learn that same information, and they don't seem to come out with that understanding.
You know what I think? I think when something hits you personally, you pay more attention to it. And so that was the case for me. We study the Krebs cycle, we study all these cycles. There's so many different pathways that we have to study in biochemistry. But that one intrigued me because I was like, you know what I did years ago was scientific. And I like to stress always that intermittent fasting is not intermittent. It's not starving yourself, basically. It's just eating intermittently. And if you think about our ancestors and the way that they ate, right? I mean, they were hunters and they didn't have grocery stores and, Whole Foods and Trader Joe's.
7-Eleven or refrigerator in their house.
Exactly. Exactly. So they basically ate what they found. And most of the time, what they found to eat was what they found in the environment, which was a lot of berries and fruits and vegetables, right? And then occasionally they got lucky and they hunted and they found a deer or a cow that or a fish or whatever. And they ate that, but that wasn't every day. And so I think our bodies are kind of built that way. And we know that now because now that we study the microbiome a little bit more, we know that the organisms in our gut, they like plants and they like fiber. And we also know that fiber is something that we as humans cannot digest. So why do we eat it, right? Well, we eat it for them and they ferment it and then they make these products for us like neurotransmitters and vitamins, believe it or not, and enzymes. And they're doing all these amazing things for our immune system. And then whatever they're done with the fiber, they get rid of it. And this is why we go to the bathroom more frequently when we eat fiber, because we can't digest it, but they do. So,
Hey guys, studies are showing that 68% of people that watch podcasts regularly don't click the subscribe button. Do me a huge favor. If you like this content, click subscribe so other people know where to go for the cool stuff. Thank you. Years ago, when I had my office on Wilshire Boulevard, there was a Korean doctor in the building, and she would talk about how in Korea they had like whole chunks of the university devoted to the values of fermentation. They're really into kimchi. Can you tell us a little bit about the origin of the knowledge base for the value of fermentation? What I love about your book also is that you're really into getting the value from food if you can, and using supplements intelligently and secondarily. I've seen so many people go to functional medicine doctors and, they get all these expensive tests and they leave with 17 different supplements and they can't digest them.
I agree. I mean, I do reserve sometimes doing gut analysis and all the expensive tests that you mentioned, but I believe that our bodies are really excellent doctors. And so when I do these wellness evaluations, we do a deep dive into what are you doing in your environment? Because you're right, a lot of it is the food that we're eating. And you talk about fermented food. And so fermented food basically has probiotics naturally in it because these are foods that have been sitting around for a while. They grow bacteria, right? And these are good bacteria that are consuming the plants, right? And then they kind of ferment and then you get natural probiotics that way. And so the Korean system that is developing all these really good fermented foods like kimchi. And I don't know if sauerkraut's probably not Korean, right?
I don't think so, but I'm not sure.
Yeah, kimchi is very, very good for your gut because of that, because it's already populated with natural probiotics. And, people always ask me, like, should I take a probiotic? And I say, you can take it as a supplement, but you can't probiotic your way out of an unhealthy gut. You have to feed those guys. Because if you're taking a supplement, what are you doing? You're just introducing more organisms into your gut, right? But you're not feeding those guys and you have to feed them. And they like plants, they like fiber. So that's really kind of where I feel like maybe a lot of functional doctors don't necessarily understand everything about how we're supposed to feed our gut. And so I always stress, number one, food. What are you eating? A really big one also is stress. What's going on in your life? Because our body is made for survival. And so if we're constantly in survival mode because we're stressed, our body doesn't understand that, whatever, we're having a stressor at work and it's going to get better. Our body says, this person doesn't have access to food, right? And so I'm going to just hold on to food. And I'm going to hold on to everything in their body that might help me survive like months without food. And that's what happens. Cortisol goes up. And then, we know cortisol is a stress hormone and that keeps us in this like fight or flight mode for longer periods. So I think it's important to understand that stress and food and also sleep was really important for all of this kind of homeostasis. So, but yeah, they do a lot at the end of the day, the gut microbes.
That parasympathetic mode is so important for our overall health. you also so tell us about, because in the book you talk about a number of people that had really terrible health conditions. I mean, people with eczema that was so bad they were scratching and bleeding, athletes that were doing crazy things with their diet and were breaking out and all kinds of acne. Tell us about some of the conditions you've seen, and how surprising it was to just do tweaks and correct that.
Yeah. So let's talk about athletes because I think they're like a big demographic of people that think they understand, health, and I'm sure they do. But a lot of athletes are eating, number one, very high protein, high fat diets. So like the ketogenic diets, right? And ketosis is not a bad thing. It's an amazing process for your body. And that's really what helps to keep your brain healthy, because your brain functions much better on ketones than it does on glucose. So I understand where they're coming from. Like they just want to feel the efforts or the impact of ketosis. But unfortunately, what happens is over time, if you're just eating those kind of diets, you tend to not eat as much plants, right? Because they're avoiding a lot of carbohydrates, and a lot of carbohydrate rich plants are very different from refined carbohydrates. But when athletes are trying to do these keto diets, they kind of forget to feed the guys in their gut. And so over time, yes, you lose weight, you have more energy, you're feeling really good because of the ketosis. But then if you continue to do these kind of diets, you're killing off a lot of these beneficial bacteria that literally are starving because they're not getting what they need. That's one thing I've noticed with athletes. So the other thing that a lot of athletes do is they take whey protein, which is great, but too much whey protein can cause acne. And so I see that a lot. I see these like big bodybuilders, they're like really buff, but they have acne and they're not able to get like this refined body that they want. So we kind of just adjust a little bit. I say, yes, stay in ketosis, but you have to introduce more plants into your diet. And I understand that you need more protein, but your beneficial bacteria are dying off. And we kind of just adjust things like that. So
Brilliant. What are some of the other health conditions you see? What is the cost to us if our gut isn't functioning optimally?
That's a really good question. And I want to talk about depression because I think a lot of my patients and just society today has mental health issues. And again, this is where the gut kind of plays a role in the gut-brain axis. And so I'll give you another example of a patient of mine who was feeling a little bit down and depressed. And she actually ended up doing a gut analysis because we wanted to see what was going on. And she was very low in lactobacillus, which is a really important bacteria. And lactobacillus actually helps to produce serotonin in our gut, but also for our body. And a lot of people think, well, like there's so much serotonin being made in the gut, like 90% of it is being made in the gut. But a lot of that serotonin made in the gut actually is for the gut. It's not for our brain. It helps with motility. So this is why a lot of times when we see patients who are depressed, they also have constipation or irritable bowel syndrome because the motility in their gut is affected by the lack of serotonin. And so this is a perfect example of where we can introduce food as not only a mood stabilizer, but also something that helps with our gut. So something interesting that a lot of people don't know is a lot of the precursor amino acids for serotonin are made in food. We can't actually make them. Like one of them is tryptophan. And we have these amino acids in our body, 27 of them. 9 of the amino acids are called essential. And the reason why we call them essential is because we cannot make them. It's essential for us to get them from external sources. So without tryptophan, this is like one of the ones I always talk about. Without tryptophan, your body is not able to naturally produce as much serotonin as it should be making. Now, people always say, well, where do I get tryptophan? So yes, there are supplements like 5-HTP, but you really need to get the majority of the tryptophan from food. So I say, start adding walnuts, start adding foods like edamame, start adding foods like bananas, eggs, beans. Those 5 are really, really rich sources of tryptophan. And so with this one patient that I had where we checked that she was low in lactobacillus and we were kind of linking it to her depressive symptoms, we introduced all those foods. I told her, you have to eat those foods every day for the next few weeks. And she found that it made a big difference for her. She's like, you know what? I feel so much better. My mood is uplifted, and it's night and day. And so that's a perfect example of how like food again can be used as medicine.
Wonderful. Um, you also talk about how the gut and knowledge of gut health can actually be predictive to some very difficult things like Parkinson's and potentially Alzheimer's. Tell us about that and where we're maybe going in terms of our understanding about how important the gut is.
Yeah, absolutely. And there are a lot of new advances in Alzheimer's and Parkinson's that are linking the gut. Fecal transplants. So a lot of patients with Parkinson's and Alzheimer's, what we found with both of those subsets is the diversity of organisms in their gut is lower than the normal population. So what does that mean? It means that we have these trillions of organisms in our gut. And the more different types that we have, especially of the beneficial ones, the better our gut health is. And that's what we've realized is gut diversity is correlated directly with health of the gut. So the more organisms you have, beneficial, of course, the better. So what we've seen is patients with Parkinson's, Alzheimer's tend to have low gut diversity. So what happens with them is the low gut diversity allows a drop in the beneficial bacteria. So they're not able to do the things that we want, right? Which is immune health and strengthening, and an increase in harmful bacteria, which release these toxins. The toxins cause inflammation systemically. And believe it or not, the inflammation that's systemic travels to the brain via the vagus nerve. And that inflammation travels from the gut to the brain and deposits there. So like in Alzheimer's, for example, we know that there are plaque that are preventing neurons from communicating properly because there's like little plaque deposits. But what we didn't realize was the plaque is inflammation and it's traveling from the gut and being deposited there. So with Parkinson's, similar process. We've seen that a lot of things that are affecting the gut, like pesticides and alcohol, are damaging the gut lining and increasing that inflammation from spreading from the gut to systemic. So again, we really have to kind of start looking at the core, which is the gut, and then healing that by increasing the diversity. And the way that we increase diversity is we increase the diverse number of plants that we're eating to feed those little guys different foods that they like.
Do symptoms like that, can they improve if one improves the gut bacteria?
I definitely think they can improve. I don't know if we can go to complete healing, but there are a lot of studies showing that Parkinsonian symptoms improve. Another one is autism, where some doctors are doing fecal transplants. And
yeah, I want to mention that for those of our listeners who are not familiar with this, because it's so crazy that we've gotten to a place where our poop is so unhealthy that by taking the poop from a healthy person, and I've actually seen, there was a while back, I don't know, a friend of mine was saying, hey, Tara, donate your poop because I'm sure it's super healthy to this whoever was collecting it. But if you take, and I believe it's FDA approved in C. difficile. And if you take the poop from a healthy individual that hasn't screwed it all up with antibiotics and glyphosate and vaccinations and whatever else causes a diminishment of bacteria, that poop is so valuable that if you take it and put it in the colon of somebody who needs it, it can actually produce amazing health benefits. Can you elaborate on that?
Yeah, absolutely. I'm so glad that you're bringing that up. And you're right. The FDA so far has only approved fecal transplants for C. difficile. However, fecal transplants are still being tested for autism. There have been some really good studies on that, and improvement of autistic symptoms and severe autistic symptoms such as lack of communication.
I've seen documentaries on this. Were amazing improvements.
Yes, an autistic patient who was nonverbal became verbal with a fecal transplant. And so I think they're also going to start being utilized for patients with inflammatory bowel disease like Crohn's disease and ulcerative colitis, because again, what we're seeing in all these conditions is a common factor, which is gut inflammation, lower levels of these beneficial bacteria. So like you said, when we're giving a fecal transplant, donating healthy stool to someone who doesn't have such a healthy microbiome, we're seeing differences. But we have to be careful because what we've seen is the microbiome is so different in different parts of the world. So, for example, if you go to Africa, their strains of bacteria, the beneficial ones, are very different from the ones here. And it's not like a foolproof method where you, like, if you take, the microbiome of somebody, like a healthy microbiome from somebody in Africa, and inject it into somebody who's in the US, you might not necessarily get the results that you want to get. So a lot of times this is where we're still kind of finding a little bit of obstacles in this.
And that makes a lot of sense because their environmental challenges are completely different than ours.
Absolutely. So what we have seen, though, that is beneficial is, like relatives, like first degree or, even secondary relatives, where we're looking at their microbiome. And if it's a similar kind of makeup and one is healthier than the other, we've seen improvements there. So, yeah.
Not to jump to another topic, but what did your family think when you lost so much weight so quickly? Are they heavy or are they all in normal weight range?
So I definitely come from a family that doesn't have the best genes when it comes to obesity. I would say the majority of them are overweight. So they were surprised back then. And then when, we would attend family functions and it was really late at night. I don't eat late at night. And I would say, I'm not eating, whatever, if the dinner's at 8 or whatever. And they used to think I was crazy. And they're like, well, are you starving yourself? And I say, no, I'm eating perfectly fine. And I'm very happy. And I eat whatever I want. I always say whatever I want, just not whenever I want. And this was years ago, and they would kind of make fun of me. And then now they're all on the fasting trend, and they've lost some weight. So I think I definitely got a lot of pushback and mockery, I guess. But I had the last laugh.
Can you tell us biologically what happens in those hours? Because I know most people aren't familiar with this, and I don't know that I've ever publicly stated it before. I've done 2 dry fasts, 7 days.
Wow.
And you feel remarkably different. And I mean, your eyes are sparkly and your skin looks younger. I mean, it's crazy. I'm not recommending it for everybody because obviously there's health issues that people have to be careful for, especially if they're on medications and things. But I'm a big fan of fasting. Do you find that omitting the early hours of eating or the evening hours are more beneficial, or does it depend on the person?
So, for me, I don't like to eat late at night because I just feel kind of gross in the morning. But it really depends. The studies say that it's better to end early in the day, because what we've seen is when you're eating late at night and you sleep, again, we have to remember that a large part of our immune system is actually in the gut. So it's not just working on digestion, right? It's working on a lot of immune functions. So what we've seen is when people eat late at night and they go to sleep, is their gut, instead of working on the immune functions that it needs to, it's working on digesting. So it kind of puts this other stuff like backed up. And this is where we start to see immune issues. We've actually even seen a link between late night eaters and increase in precancerous colon polyps. So I think it's better to stop eating within 3 hours of sleeping, but it kind of depends. It's, again, we live in a world where people end work late and they come home late and then they're eating a late dinner and sleeping. So what I say is, if you can eat, under 3 hours before sleeping, it's better for you. But if not, then you know what? Just extend the fast to a little bit longer in the morning and you're still benefiting your body. So yeah, this is actually my favorite topic. I love talking about what happens in your body when you're fasting and at what hours. So,
would you briefly mention those things? Because I do find that whole process fascinating.
Yeah, absolutely.
Certain amount of hours this has happened, it's another certain amount of hours this has happened. And I mean, with the dry fasting, my understanding is that when you get into days, 5, 6, your body starts pulling stem cells from your femur.
Autophagy. Yeah. So, okay. So let's start from the beginning. So, all right. So I always say, remember we said our body is made for survival. It's not made to feel great. It's made to survive. So let's just hypothetically say you had dinner around 6 o'clock and your pancreas releases insulin because insulin is required to transport glucose into cells, right? We need that, like the two work together. Without insulin, glucose will not be able to enter the cells. And this is how people with diabetes develop diabetes, because they don't have enough insulin to transport glucose into the cell where it's needed. And so the glucose kind of stays in the bloodstream. And then this is where the problem is. So what happens is you eat, insulin is released, it transports glucose into the cells. Everybody's happy, right? The cells are fed, everything's great. But then what happens is once that process is completed, now your insulin levels drop, right? So again, let's remember your body is made for survival. Your insulin levels drop, your cells still need fuel. So your body is like, okay, well, you know what? She ate and it's really easy for me to release the insulin, the glucose goes in the blood and in the cells and everything's great. So a few hours after you stop eating is when your insulin levels really drop. And that insulin drop kind of alerts your hunger system to say, hey, what's going on next? Are you going to feed me or do I need to do a little harder work? And so you have one of two options. You either eat again, right? Because a lot of people feel hungry. They want the like late night munchies, or you don't eat. So if you don't eat, what happens there is your body now decides that it has to tap into secondary sources of fuel for cells, because cells need fuel all the time. So it kind of waits and nudges you a little bit, and you feel hungry. And I always say, like, just ignore that hunger at night, because that's kind of just your body like trying to take the easy road. So if you ignore the hunger, what happens is another hormone in the pancreas is released, and that's glucagon, and it has the opposite effect of insulin. And what glucagon does is it starts to stimulate the liver to release these stores, believe it or not, of glucose that we have in the liver called glycogen. So it starts to release glycogen, and then the body's happy. Their cells are happy because they're getting their glucose again. Glycogen is transported. And this usually happens about 6 to 8 hours after our last meal. So if you don't eat and you kind of ignore that hunger, at 6 to 8 hours, your body is forced to get that glycogen it needs, because it needs to fuel cells. So glycogen fuels cells through breakdown. And then your body runs out of glycogen stores. So now what, right? So I call this plan C in my book, plan A, plan B, plan C. So now what? Your body's like, okay, you don't give me food. I burned all the glycogen. Now you're asleep. Most of the time it's like you're asleep, right? It's like 4 a.m. and your body's like, I don't know what to do. So I'm going to have to go to fat and start burning fat, right? And that's what the body does. It goes to fat cells and it starts to burn fat cells. And this is where everybody loves this term, ketosis. So this is where we get ketones, and ketones are also fuel for cells. And they're actually like a much better fuel source for cells than glucose is. And I compare it to like premium gasoline versus unleaded. And so that's what ketosis is. And when
don't we get more ATP and when we burn a fat molecule than a sugar molecule, like considerably more, like 40% more?
Exactly. Absolutely. So, and this is part of it. And so your brain function is really well in the morning, and you're just, feeling great. And then I'm going to add this because a lot of people will say, I don't feel that great in the morning when I haven't eaten. Like, I feel like I need to eat right away or I'm going to pass out. That's because you've never tapped into those secondary sources, and your body's just addicted to glucose. And it takes a few weeks to get over that withdrawal, just like anything else. So now your cells are happy. You're fueling with ketones. And this usually starts at about 14 hours. And some people, it starts a little bit later. So this is why we have like the 16 to 18 hour most people do.
What do you think about cheating at that point? Not bad cheating, but good cheating with like the coffee and the butter or the MCT oils.
Yeah. So what the studies have shown is, like, say, for example, you stop eating at 6 p.m. the night before and you wake up at 7 and you want your coffee. It's okay to have your coffee because it's 0 calories. So you're not taking your body out of ketosis. And even what I say is, like, if you want to stay in ketosis, but still have your coffee, and like, say you like a little creamy coffee, you can add a dash of heavy cream in there, which has 0 carbs. But the key is to put whatever you're having in the morning, that cheat, it needs to be less than 50 calories. Because if it's more than 50 calories, it kind of takes you out of ketosis.
Is butter or MCT oil okay? Because a lot of people do that.
Butter and MCT are okay as long as they're less than 50 calories, because they're 0 carbs. So yes. So as long as it's not taking you out of ketosis, you're fine.
Okay.
And so that's really what's happening. Now, you mentioned 7-day fasts. And I think in some people, it works really well. And you're right. At around day 4 or 5, and I think actually even earlier than day 4 or 5, your body starts to kick into something called autophagy, which I call like low battery mode of your body, because your cells have a lifespan too. And when your body is not eating for that long, it kind of starts to panic, and it starts to do like an inventory of your cells. And it's like, oh no, she's not eating. I don't know what's going on. I need to kill off some cells to save all that energy for the really important cells, right? Because that's what you do when you put your phone in low battery mode, right? Is you're like, I need my phone to make phone calls in an emergency. And I only have 10% left. And so that's what your body does. It starts to kill off these old cells that are kind of like getting a little old, dysfunctional cells that might be turning into cancer. And so this is where you get that autophagy. I don't usually recommend long fasts, like more than 5 days, because some people, their body starts to turn to muscle and start burning muscle because it gets desperate.
So my understanding from Dr. August, no, sorry, he's not a doctor. He's a scientist with the NASA, August Dunning, that actually, and this is so counterintuitive, but if you dry fast, which is no food, no water, you actually retain muscle mass better.
That makes sense. Yeah, that actually makes sense. I just think a lot of people aren't able to do that. And I think
it's actually easier. I know it's so counterintuitive.
Yeah.
It's just like something shuts off in your body that it's easier than water fasting in my experience and in his experience. He says he's tried both. I've tried both, and it's not easy, but it's less hard than you think it is.
That makes sense, actually, because I've never fasted for that long, but like on days where I just want to fast a little bit longer, if I notice if I start to drink water, or it just kind of stimulate your tract, like it's almost like, oh, like what is she?
And they did studies that show that it does retain muscle mass better. Because I went back into the gym and I didn't lose my ability to move my weights around.
And I think for the majority of the population, like if they're going to do a longer term fast, they really should speak to their doctor and just make sure that everything's okay.
Oh, of course, yeah, especially if they've had any health issues. Absolutely.
And there is, I don't know if you've heard of Prolon. Have you heard of Prolon at all?
No.
So it's interesting because it's this patented formula that was made by also I think he's a UCLA scientist who studied fasting for many years. Walter Longo.
Okay.
I think it's Walter Longo, and he made this protocol where you're eating food. It's a 5-day fast that mimics a 5-day water fast, but you're actually eating food during this fast. And he's kind of perfected it where you're not losing as much muscle mass, but you're still getting the benefits of autophagy. So I've done that, which is great. I mean, you feel really good after doing it, and you get the benefits of autophagy, which you've already felt from the 7-day fast. But I think for the majority of people, it's very hard to do. And so I usually just say, you know what, even if you do a 24-hour fast, like once a month, or even a 36-hour fast, it's really beneficial.
Have you observed more, because these are tough for people to have access to for financial reasons, and there just aren't that many supervised places around the country.
Yes.
There are just not that many.
No, you're right. I think people just don't know enough about fasting. Most doctors don't really get a lot of nutritional training.
Yeah.
Who do you trust the most for information about your health is doctors. And so, it's interesting. Like a lot of people tell me, like, what is your goal in doing all this, like gut health stuff? And it's really to teach people about the importance of gut health, but to teach doctors about the importance of gut health and nutrition, because they are the future, right? And I think we need to start incorporating into medical schools, like a nutrition course, medical schools, nursing schools, like anyone in the healthcare field really should not be able to graduate without a nutrition course.
Oh boy, do I agree with that. I don't know how soon that's coming, but I totally agree with you.
No, I think there's a school in Arkansas started by the heir of the Walton, like the Walmart family. I think her name is Alice Walton. She started a medical school where they're incorporating nutrition.
Nice.
Yeah.
Nice. You mentioned a variety of foods in your book, which again, I love, and some of them are not so easy to find. I mean, where do you get chicory root?
Yeah, you're right. It's hard to find, but you know what? Chicory root, why it's so great is it has this fiber called inulin, which is, I call it like the favorite food of our gut bacteria. It's like a party for the gut. And so whenever we eat foods that are rich in inulin, they love it. They just produce all these great things from it. So we have a lot of supplements with inulin fiber in them. So you can find like an inulin fiber supplement if you can't find chicory root. But there are other vegetables that have inulin in them, like asparagus and onions, for example. So again, I have that list in the book of the best plant-based foods and what they do to feed your bacteria. But you're right, it's not that common here. I think it's more like, I feel like a lot of African like tribal groups eat more chicory root because it's more available. It's like that really fibrous a part of the stem. Like artichokes also have that like inulin in the stem. So I always say cut the stem too much, like eat that, because a lot of people will eat the hearts and not the stem. So cook it well enough that you can eat it, because that has a lot of inulin too.
Really interesting. And it seems to me that, I mean, you mentioned glyphosate numerous times in your book, which I also really appreciate. It seems like our food has been pretty compromised. So getting to know your farmers, eating locally, speak to us about the importance of all that.
Yeah, I mean, we've seen the pesticides that are in the crops really affecting our gut microbiome. You mentioned glyphosate, and there were a few studies out on Parkinson's, since we were talking about Parkinson's. I don't know if you've seen that study where they noted that people who live within 3 miles of a golf course had a 63% higher incidence of Parkinson's than people who didn't.
Wow.
And the reason why they're thinking it is because of the pesticides in the golf courses, because they have to maintain them and make them look beautiful and green and plush, right? Well, the water supplies are being contaminated, and people who live within that 3 mile radius of them. So we definitely know that that's affecting it. It's hard, right? Because I think we're surrounded by all this horrible food in our system. And so I say, you're right. You said it. Get to know your farmers. Maybe start growing your own food. Definitely, if you can afford to get organic in certain things, do it.
You talk about the Dirty Dozen and the Clean 15 and the Environmental Working Group. You want to mention that to our audience?
So Environmental Working Group, EWG.org, is a group that comes out with a list of foods and products too that it gives a rating to. And there's a Dirty Dozen and the Clean 15. And the Dirty Dozen are the fruits and vegetables you should never buy not organic, because they have such a high level of pesticides. The Clean 15 are those that you can. If you don't have the money to spend on organic for everything, the Clean 15 are foods that have lower levels of insecticides in them. The other thing I like to tell people is if you want to get fruits, for example, and they're not organic, you can put them in like a big bowl of water and put some baking soda in there, like a teaspoon of baking soda, and let it sit for 15 minutes. And what we've seen is the baking soda draws out the pesticides.
Wow.
It's not going to take it out completely, but they found that it takes out more than 90% of the pesticides that are in.
That's amazing.
Yep. So
I know when they were really into, and it was all the rage. It may still be alkaline water. If you put it on the acidic setting, it'll also do the same thing.
Yeah, I don't know about the whole alkaline acidic. Like I'm definitely a believer that your body being in an acidic environment all the time is not the greatest, but I also believe like citrus food is acidic. There are a lot of things that are acidic that aren't bad for you. So I think people focus too much on like these little things and whatever's trendy. And I just really want to simplify it, because we do have jobs and we have families and we have so many things that we take care of. So I just usually say the most important thing is if you eat healthy 70% of the time, your body's able to kind of compensate the other 20 to 30%. And a really big part of your plate should be vegetables and fruits and legumes, beans, because that's what feeds those guys. And we like to make them happy. So make them happy first. So at least I would say 60 to 70% of your pie ratio should be that. And then everything else, protein, meat, whatever it is, just eat that. But really you want to feed those guys first before you feed yourself, whatever you like.
And is it important that those are all organic beans and?
Not necessarily. Not everyone has like a wallet that allows them to buy whatever they want. So I think if you're eating more beans and vegetables than you were eating, again, your body's able to kind of extract what it can. If you can get organic, that's great. But if you can't.
Awesome. So, having a scientific, peer-reviewed study is a big deal. Tell us about the study that you did that linked COVID severity to gut health.
Okay, so that was a review study. I like to say that because a lot of people are like, well, you didn't do a clinical trial and it wasn't tested on people. And they're right. But we did this study during COVID when everything was shut down and we weren't able to have access to hospitals. But my story about that study is I live in New York City. I have a practice, a private practice that focuses on gut health, wellness, and weight loss. My husband is also a doctor. He's a critical care specialist. He worked in the hospital. And during COVID, COVID hit New York pretty early. And so I found myself having a lot of time because we were considered non-essential, anyone that was not in the hospital, whereas it was the opposite effect on him. And he and his colleagues were kind of thrust onto the front lines, seeing the really, really sick patients that were coming in. And it was a scary time. And there were a lot of really scary protocols that they had to go through. But he would come home every night early on. I'm talking in March, right? When this first happened, March of 2020. He would come home and tell me about the patients that he was seeing that were getting really sick and ending up in the ICU. And I was asking him, is it all like really elderly patients? And he says, some of them are elderly, but oddly enough, some of them have no medical problems at all. And they're just maybe like slightly overweight or no medical issues. And we see a lot of people in their 30s and 40s. And what obviously we were all seeing is children were really not getting sick. They were getting like mild cold symptoms, and that's it. And so kind of me being like this gut health nerd and getting the information that he was telling me, I was like, started to think, I wonder if there's something in children's guts that's protecting them from these more severe infections. So the more he and I kind of like discussed what he was seeing, he also found that patients in the ICU had these really high inflammatory markers that they were testing. And I'm not going to get too detailed about this, but one of them was like interleukin 6. And interleukin 6 in the immunology world, everyone knows that it's a pro-inflammatory marker that the body releases. So people who are under a lot of stress, people who don't sleep well, people who have underlying inflammation, heart disease, diabetes, the common thing with them is they have high interleukin 6 levels chronically. And when you have high inflammatory markers on a chronic basis, it's not good for your body. And so this is what they were finding in their patients, is that a lot of them had these high levels. And so we kind of started to look at children's guts, and we found something very fascinating is their gut microbiome is very different from adults. And I'm a believer that it's God's gift or nature's gift to them when they're born to kind of like help them prime their immune system. And the reason why their gut is very different is they have a very high percentage of this one bacteria called bifidobacteria. And 70 to 80% of their gut is this just one bacteria, which is really interesting, right? And what we also found in these review studies of bifidobacteria is that the levels of bifidobacteria start to slowly decline as we age. And very low levels or absent levels are present in a lot of people with medical problems. And these are the same medical problems that we were seeing in the ICU. And so we kind of started studying bifidobacteria a little bit more in detail to see how it functions as a beneficial bacteria in the gut. And it was fascinating because we started seeing the function of bifidobacteria was exactly matching what my husband and his team were seeing causing symptoms. So it downregulated these inflammatory markers, one of them being interleukin 6. It's very powerful in downregulating interleukin 6, but it's also very powerful in increasing these really potent anti-inflammatory markers. And so the more we kind of looked at this bacteria, we started kind of putting two and two together, and we said, you know what, we think this is what's protecting children from more severe infections because they have so much of it in their gut. When they get infected with COVID, bacteria kick into action. They downregulate these inflammatory markers immediately, and they don't really get us sick. But if somebody has an unhealthy gut and they don't have enough of this bifidobacteria in their gut, and some people, unfortunately, who got really sick or passed away, later studies showed that they had no bifidobacteria in their gut. So this is what we linked, and we started recommending probiotics with this bacteria in it to our patients. This was, again, our study was published in May, so it was very early. We tried to get it out as fast as possible. And we recommended to our patients a protocol of this probiotics, very high dose, once they got COVID, also very high dose vitamin D, because vitamin D acts as a cofactor in the gut. Zinc. So those were the three that we were recommending for 2 weeks. So once you found out you had COVID, immediately that was the protocol. And if you wanted to prevent, you were taking a high dose probiotic all along just to kind of help you. And we found that my patients, nobody got so sick that they needed to be in the ICU. And so we published a study and we shared it, but we got a little bit of resistance, unfortunately, in sharing it. And I don't know why. I feel like it's something that wasn't detrimental. Like you're not going to die from, probiotics and vitamin D. But I guess there was a little.
That was a very funny time. It's like there were a lot of people who were noticing the effects of very safe nutrients that have been around forever and some very safe drugs that have been around forever that all had positive effects. And somehow it just wasn't meeting the light of day.
Well, I'm glad you mentioned that. I'm going to talk about them. So hydroxychloroquine was one of the drugs that was used very early on, and we actually put it in our study. The mechanism of action of hydroxychloroquine is to lower interleukin-6 levels. We found that. And so that was probably what was happening. But very interestingly, ivermectin was another medication that was given. And there was a study on that one that showed the mechanism of action, that it also dropped interleukin-6. But here's the brilliant thing. Do you know how it dropped interleukin-6 levels?
No.
By increasing the levels of bifidobacteria in the gut.
Oh, interesting.
It's an antiparasitic traditionally, right? That's what we use it for. And these antiparasitic medications, when they're in the gut, they get rid of parasites, but they increase these beneficial bacteria. So it's kind of like, I always say, it's like a corporation in your gut. It's a team. And so everybody works really well together, at least the beneficial bacteria do. And so that's what we found was the mechanism of action of ivermectin. So a lot of people say, I take ivermectin. I say, you know what? Just eat the foods that have bifidobacteria in it. And if you have to supplement with a probiotic, do that too. But ivermectin indirectly increases bifidobacteria levels. So,
and all supplements are not created equal. In your book, you mentioned 3 things that are particularly important. My understanding, because I know people that work at testing companies, and they say that 90% of the stuff out there is garbage. So it's really important to get a good, solid recommendation for a company that tests before, during, and after for purity and potency. Tell us about that.
I agree with you. Third-party testing is really important as well.
Unbiased third-party testing.
I mean, if there's a clinical trial using the supplement, it's even better. But clinical trials, especially randomized, controlled clinical trials, are expensive, and so a lot of times you're not able to do it. But if a drug has been studied in a clinical trial, or a supplement, it's definitely better if you see the effects.
Which doesn't happen a lot, because the financial, it's nothing compared to what a drug receives for financial remuneration when it hits the market.
Absolutely agree. Yeah. A lot of people ask me what to look for in a probiotic. So what I say is 3 things that you want to look for. You want to look for the number of strains. You want to look for the colony forming unit count. So what does that mean? Remember, you're taking organisms in a pill, right? And so the more organisms you have, the more likely they're going to be able to bypass the stomach acid, which kills a lot of these organisms, and get to the lower intestine, which is where you need it. So I usually recommend for you to look at the back of the bottle. The CFU count will usually say the number of organisms. Remember, you have trillions of organisms. You want to find one that has at least 30 billion organisms, because again, we want to ensure survival. The other thing you want to look for is the number of strains in your probiotic. And this is something I also like to stress, because people will say, oh, I'm taking lactobacillus, or I'm taking Akkermansia. Okay, great. But please don't do that for a prolonged period, because what you're doing is you're only introducing lactobacillus, you're only introducing Akkermansia, and then you kind of disrupt that homeostasis in the gut, right? Again, they're all working really well together. So if you need to take a single strain probiotic, take it for a short period, because they do work differently on different things. So take it for a short period, not for a long time. So the really important thing that you want to look for is the number of strains in your probiotic. So the more, the better, because again, you need diversity. We talked about diversity. And then the other thing that you want to look for is really quality. And again, if it's third-party tested, it's really important as well. So just a few things kind of to look for.
And you also mentioned that it's important to take it away from food because you don't want to get those stomach acids that will contribute to destroying them. With fermented foods, my understanding is that by the diversity which you're recommending, different foods are grown on different soils and they pick up a whole different strain. Different types of food capture different strains. So truly, by getting a broad variety of nature's probiotic, which is fermented food, that's a great way to go. How much fermented food do you recommend people eat a day?
That's another really good question, because a lot of people don't tolerate fermented foods as well as others. And usually it's because either there's a dysbiosis going on, which is that imbalance. Sometimes people have something called SIBO, which is an overgrowth of bacteria in the small intestine. And yes, bacteria is everywhere, but it's mainly confined to the lower. But some people have this overgrowth in a little bit higher up. And so when they take a probiotic, it kind of just doesn't sit well. Or if they eat something fermented, it doesn't sit well. So I say usually start with like once or twice a week where you're introducing fermented foods. And if you tolerate them, then, go to 3 to 4 times a week. You don't necessarily need them daily. You need to feed them daily, though. You need to feed the guys that you're introducing food that they like. So more importantly, you need the plant-based fibers daily, but not necessarily the fermented on a daily basis.
Beautiful. If you had a megaphone and the whole world was listening, what would you like to say?
I would say, let's see, remember this name, bifidobacteria, because it is probably the most important factor in your immune health.
Wow. Beautiful. How do people find you? I love that your book is available on audio because that's a really convenient way to get through material.
Yeah, my website is fromwithinmedical.com. I also have a social media on Instagram where I don't post bikini pictures because even though I think I would have gotten more followers, I like to post only really important educational information there. I'm on LinkedIn as well. But so my book is on Amazon and Barnes & Noble and a lot of other sources.
Fantastic. Well, I could talk to you for another 5 hours because you're a fountain full of information. Christine, thank you so much for being with us here today. Folks, you can find Dr. Christine on those channels and we'll leave them in the show notes. And please share this with other people that would benefit from Dr. Christine's knowledge. And we'll see you on the next episode of Next Level Healing. This podcast is intended for the purpose of providing information and education. It does not provide advice and is not meant to be used for any self-diagnosis or the replacement of any kind of licensed professional. The creators and individuals appearing here do not endorse any specific tests, positions, medications, products, or procedures. The views and opinions expressed in this podcast are of the speakers and do not necessarily reflect the views or positions of any entities they represent.